Hello, and welcome back to this episode of This Healthy Life podcast. I'm very excited for my guest today. I have Dr. Brian Licuanan, and he is here to share his experience with helping people heal from addiction. He's a board-certified clinical psychologist with over 20 years of experience, and here to share his wealth of knowledge on helping people with substance abuse, insomnia, and family intervention. Dr. Brian, welcome. So happy to have you here today.
Thank you, Erica. It's nice to be here.
Great. I love having this topic because this is a topic we have not had on the podcast yet. And I think so many people in the world have an experience or have a loved one or have an immediate family member that is suffering from some level of addiction. So really happy to have you share kind of your tips and tricks and how we can help people.
Yeah, I appreciate you and entertaining the conversation.
Absolutely. So I'd love for you to share a little bit about yourself, some of your background and how you got into this space.
Sure. Well, I am a California licensed psychologist. I have my PhD. Various work that I do. Currently, I am 100% telehealth. I see clients throughout California. I also worked for almost 15 years at a treatment facility for adults, males and females, struggling with substance addiction and pretty significant mental health conditions. I also have a specialization in insomnia. I work a lot with substance use disorder, and now I am working a lot more as a family crisis strategist, helping family members to re-empower them and know that there are things that they could still do to help or even save a loved one who's resisting any type of help or don't realize that they are struggling, as well as giving talks and support groups and education. So one of my biggest passions is spreading mental health awareness, just like with this, in various venues such as podcast or wherever opportunity there is to educate the community on mental health.
Mm-hmm. Awesome. Yeah, it's great that you're doing this sort of work. There's definitely a big need for it. So good to have you in that space.
Yes, thank you.
So I want to kind of start just kind of diving down and breaking down addiction and kind of understanding it. You know, there's obviously kind of different levels of addiction. Some people, you know, you can refer to them as almost like high functioning addicts, and other people like really hit rock bottom. So what's kind of the spectrum, and what are some different kind of telltale signs to identify what stage of an addiction a person might be in?
Yes, you're very right. And I'm glad you bring that up, that there's what I find in a lot of the work that I do, there's a spectrum, right? We always assume it's either all or none. Like depression, there's a spectrum, literally a mild to moderate to severe level of symptomologies. With addiction too, as you mentioned, that there are people who are just really struggling in most aspects of their life to people who are able to function, maybe in the work setting to a degree. Just on that level, what we find are people who are somewhat functional. That tends to where it's welcome over time as someone continues to engage, and especially if they're not getting help and the condition is exacerbating or worsening over time. But addiction, typically speaking, addiction can come in many forms. You can have an addiction to a substance or even sometimes a behavior. But typically how we look at addiction generally is you're engaging in some behavior that it's difficult to stop. And there's actually a great deal of realization that that behavior is harmful, but it's just difficult to stop. People engage in those behaviors essentially at all costs, whether it be in private or drinking alone, using a substance. It becomes very isolatory, and it's impacting several areas of their life on a significant level. So that's generally speaking of how we conceptualize an addiction.
Mm-hmm. And so I can imagine probably someone that's more on kind of the high functioning side is almost a little bit more difficult to deal with because they don't necessarily want to admit they have a problem, right? Or they think they're doing fine, they're making it to work, they're keeping up with their social obligations. So how do you kind of, bring it up to a person and, work with their friends and family to kind of help guide them and maybe kind of let them know that from the outside you're seeing that, hey, there might be something going on here, I want to help you. What's a good way to approach that? Yeah.
And if I could upfront that first before I get there, because I think there's something important as well, is sometimes people who don't understand addiction aren't realizing why they have an addiction to begin with. And a lot of times what we find is people gravitate towards a certain behavior or a substance is because essentially it works for what it's originally intended. And usually it's to provide some level of relief. And that, and a lot of times the person could be suffering from some degree of stress or pain. And that pain could be a physical or some type of emotional pain. And that is what they believe is the solution. And so That's why sometimes people are afraid to get help, is because they truly believe that that is the one tool or action or behavior or activity that is providing them relief. And so back to your question, great question in terms of how do we approach someone with an addiction? Sometimes there's different ways of doing it depending on the circumstances and the severity of their addiction. But typically speaking, talking to someone and letting them know that you care about them and there's some changes that you're noticing that you're concerned about, and that you're a safe place to which they can talk to about it. You may get different reactions from that person depending on where they're at. But typically speaking, those people who give feedback are people who are more intimately connected with that person. That person could be a family member, a spouse, a good friend, best friend, cousin, relative, sometimes even a coworker. But I think it's really important to address the question. We don't want to make assumptions. And sometimes the people who are struggling are wanting someone to ask that question. Mm-hmm. And so when you approach someone, really come from a safe place and pull them aside and in private and identify the behaviors they're concerned about, and to offer that I'm here to help support you in any way that I can.
Mm-hmm. Yeah, I think it's always kind of a slippery slope. I've been very blessed, and thankfully in my family, I don't have anyone with addiction, but I certainly have friends that I've come across through my lifetime that, it's like borderline of, are they just having fun or do they have a problem? And like, how do you kind of approach them without, creating some kind of barrier or wall that they're going to close off from you because you brought this up and suggested that they might have an issue, right? So how do you kind of tiptoe around that? And, what's a good way to approach someone that makes them feel heard and comfortable? I think you kind of mentioned like, coming from a place of, love and kind of just checking in with them. But what's kind of a good approach? And if you are met with that wall, how do you kind of still try to help the person, but still respect kind of their barriers or their boundaries, if you will?
Yeah, and it's a tough question. Like I said, a lot of it depends on the actual person, and where the degree of where their struggle is. And so I think one of the biggest things is a rapport building, right? Usually people are going to open up to people who they trust and feel comfortable with. So definitely build that rapport. And like I mentioned earlier, and not just when approaching this scenario with any type of feedback, we want to address the actions and behaviors. We want to stray away from any labels like, hey, you are really not smart about how you're doing life, or you seem pretty reckless and careless, and just say, hey, I've been noticing you've been isolating more, right? And I'm a little concerned about you. Is there anything that I can help you with? Or I've noticed that you've been drinking a lot more. On some level, there's that place where we don't want to tiptoe, but we also want to be tiptoe. We don't want to keep the white elephant or pink elephant in the room, so to speak. And like I said, addressing those behaviors and how you feel and what you're requesting of them. For example, hey, I've been noticing that you've been spending a lot of time drinking alone a lot, and I kind of feel a little bit concerned about your health overall. Hey, I just want to request that if you really feel like you're in a tough spot, please reach out to me and I'll help guide you in whatever way I can. But if I may say too, for your listeners out there, some telltale signs, because sometimes people don't realize whether or not it's a problem or not. The important thing is don't make assumptions, right? Sometimes we look at superficially and we think that people are doing well just because they're smiling and laughing and successful in areas of their life, but we don't really realize what's going on underneath. And then assuming if someone's in a bad mood, we just want to jump to conclusions that they're an addict, right? But telltale signs to look for, I think, on a very general level, are major changes in behaviors, right? If someone's, again, becoming more extreme, they're either isolating or they're just engaging activity on a more exaggerated level. Change in hygiene could be a big thing. They're just not taking care of themselves, or they're just energy changes. Maybe their thought process are a little bit erratic in the workplace. Maybe their work performance is deteriorating, or they may just be talking about it in general. And so just look out for those things and be mindful. And like I said, we can still come from a sensitive place, but also recognizing where our limits are too. Right. One thing we don't want to do is become their therapist and counselor and become that one person. So, but you want to tell them that, hey, I'm here to support you. I'll guide you in any way that I can.
Mm-hmm. Yeah, absolutely. It's all about making sure that they feel heard and loved, right? And help them in the process. So
Yes.
definitely good tips. So you mentioned kind of, people might start gearing towards an addiction kind of path in life if they're experiencing like pain or mental health issues. What are some kind of like root causes, if you will, that tend to kind of trigger addiction in people other than those stuff?
Well, addiction doesn't necessarily have to be a substance. Like I mentioned earlier, behaviors, right? Yeah. Behaviors can be addiction. Eating, working out excessively, cutting behaviors. So I just wanted to, gambling and so forth. So for your listeners out there, addiction can be a substance, but it could be behavior as well, things that we engage in. And a lot of times, where that comes from is these behaviors are a tool, or maybe in some level, a sophisticated tool for attaining relief. Usually people are in some degree of pain and suffering. That could be physical or emotional pain. And so that substance is used as some form of solution or an attainment of relief. And what the struggling thing that happens with those behaviors is, of course, especially if they are not healthy, right? A substance or self-harm behavior is the person becomes reliant on it, and they shut down any other solutions or options to also getting help and relief. And of course, on a substance, then there becomes a physiological dependence in addition to an emotional dependence. And so that's why a lot of people are very afraid to seek help and treatment, is because they are worried that they are going to have to give up that, what I call the life preserver, that one thing or behavior that they believe is saving them or navigating through this distress or this pain. And so that's why a lot of people are afraid to do that. And that's where getting help and treatment gives them options. Like, wow, I didn't realize that meditation has the same effect as smoking THC in terms of relaxing myself, or talking about my struggles is as effective in relief as taking a shot of vodka. And so that's what treatment does. It shows them that there are other options to put on their tool belt.
Mm-hmm. Yeah, absolutely. And so let's shift gears a little bit. So you have an award-winning book. You said it's called How to Get Your Resisted Loved One into Treatment.
Yes.
And so you kind of outline a step-by-step plan for, if you do have someone that you're trying to help and how to get them into treatment, kind of a process of how to approach this. I'd love for you to share a little bit about your book and some of the process that you've written about in that.
Thank you. So the book was released and published and released a few months ago, this past May of 2024, and it was the result of what I believe are the gaps of knowledges and skills that came about in a lot of my work that I do with different populations. In the treatment center or in the talks that I give, in my support groups, is that there was these really, really recurring questions that family members would present with in terms of, for example, they're fearful of taking action, or they don't know what action to take. And so they start to feel very helpless and hopeless. And so they're paralyzed. And because they feel like they've done everything. And so all of them are very stuck. And so after a while, I was getting asked all these different questions, and it became very, very consistent and thematic in the type of questions that I was being asked. And my responses, as a result, were also very patternistic and consistent. And so I got various people asking me if I have it written on paper, these solutions, or an outline. And I had one gentleman in one of my support groups says, you know what, you should put this in some type of a manual. And that's when it dawned on me that, number one, I was surprised that there was nothing out there already, like a strategic manual, a step-by-step guide. There's great information out there. It's just what I found was more specific, like, how do you deal with setting boundaries? How do you get self-care for yourself? What can you do? A lot of well-meaning resources out there, but I didn't have one that it was a step-by-step process. And to answer a lot of the questions that families were stuck in. How do we deal with guilt? What if they're suicidal? What if they're psychotic? How do we call the police? Is it better for them to be at home struggling with a substance, or out on the street being victimized? And so it was hopefully an answer to a lot of these questions. And so Yes. And so I write about what I believe are the 25 must-know knowledges. That is the majority of my book. It is what I believe, no matter what level of education or experience you have with mental health or addiction, it is the most foundational knowledge based on the recurring questions that people have, as well as I talk about setting healthy limits and boundaries to a step-by-step process of how you vet the family members who are going to be involved in the process, and how to recognize what their own part is and how to execute the plan to hopefully get their loved one to a place where they accept help or get a higher level of care.
Mm-hmm. Yeah, that's a good point too, because it's like, there's the person that's obviously struggling with the addiction, whether it's a substance or behavior, like you mentioned, but there's also the whole family side that's kind of going through an emotional roller coaster with them as well, right? And like, how do you take care of yourself in it? How do you set boundaries, but how do you still help them and like be there for them? So what kind of advice do you have for the family side or the people that are trying to help a loved one get care and help?
Mm-hmm. Well, the biggest part of it is that when the family dynamic, and this is where my book was geared. It was not geared so much as an intervention for the struggling person. It was geared for an intervention on the family unit, because a lot of times, I would say 100% of the time, one of my must-knows is the reason why a person continues to struggle chronically for a long period of time, I tell family members, is because they can. On some level and form or capacity, the family unit is perpetuating the issue. There's a saying of the 3 C's: you didn't cause it, you can't cure it, you can't control it regarding the disease, whatever they're struggling with. But on some level, you've participated or even perpetuated it. In our language, we say enabled it.
Okay, I was going to say enabled it,
yeah,
right?
That's what it
is.
is.
A big common word.
And enabling, though, too, one thing that I like to write about is I like to destigmatize a lot of words or clarify its meaning. Because out there in the community, we get these family members who say, oh my God, enabling, so bad. Literally almost equivalent to a curse word, so to speak, when we're working on the family dynamic. But if we really think about enabling comes from a place of love. That's what we do. When your loved one is struggling without food, you give them nourishment. When they don't have a home, you give them protection. And however, those loving behaviors can perpetuate a problematic issue. And one thing I like to say is, if you have a loved one who lost their 5th job in 1 year because of their struggles with substance, and you keep giving them resources and money, where is that motivation to stay sober or healthy? And so that's where I'm geared towards, because you can get the person help, but if that family unit isn't willing to change and recognize their own part and make revisions and be a part of the process, the chances of long-term success dramatically decrease for that person and the family unit.
Yeah, absolutely. And then so if you are able to get your loved one into some sort of treatment, right? So, you mentioned addiction is different. It can be behavior, it can be substance, it can be high functioning where they just need like a little bit of support to maybe change habits. So is there kind of like an overall approach to treatment that works in general for most people that are dealing with some sort of addiction, or does it really vary case by case depending on what that person is struggling with?
Yeah, great point too. Again, it could be a case by case basis. And one thing, I know my title of my book says how to get your resisting loved one to treatment. And when I was thinking about the title, I was thinking about that in terms of, are people going to look at it as just the formal treatment, going to a facility? Because sometimes people, for whatever reason, that's not a possibility for them, whether it be affordability, accessibility. But I also like to say how to get your resisting loved one to a point of accepting help, and whatever that help can look like. And there is no one pathway to get help. There's some people who say, well, Alcoholics Anonymous for alcohol is the way. Some people say, no, that's not. Or some people say going to a treatment facility is a way. And some people say, no, I'm going to go through my church. So there's not one particular way. But I do believe there are components, attributes of the help process that lend itself for a higher degree of success. Number one would be family involvement. Right. I would say 99.9% of the people that come to treatment, they're not hermits, or they don't live in complete isolation, and that they can survive on their own. Like they can afford treatment and so forth. No, most of the time they're part of some type of a system, a family system. And one thing I talk about, one time I literally had a client whose landlord was showing up to treatment. I didn't ask questions. That's the first time I ever had a landlord showing up, and I'm like, okay, you're part of the support system. And he was very emphatically involved and part of the support system. Usually, obviously, it's spouses or parents or relatives or siblings, but there was a landlord. But most people are involved in some type of a system. And so attributes of a system involvement on some capacity is critically important. Other elements of things like structure, having structure, routine, and accountability. These entities who are going to hold you responsible. Some elements of that, in addition to other things like being honest, being open to direction, are attributes that you can get. Doesn't have to be in a formal treatment place, but I talk about some of those very, very robust attributes that lend itself for people to be successful on a long-term basis.
Mm-hmm, mm-hmm. Okay, that makes sense.
Yeah.
And then so in your book, you kind of reference the 25 must-knows or must-dos, right? So if you had to pick maybe like the top 3 that are the most important that, the family members can use or the loved ones can use to helping the person that they're trying to help, what are kind of the top 3 in your mind that you feel like are non-negotiable, absolutely critical to make sure you're implementing?
Well, the very first one, must know, the very top one is must know to have hope. Right? Hope of this belief that something good can happen is because a lot of times, so my book was originally designed for people who were in severe crisis. They didn't know what to do. Their loved one's been struggling for a long period of time. They feel out of options. And for not only for the family, but for the person struggling to have hope that there are still things you can do. And the way we've been doing it hasn't been working. And it's very humbling for the family for me to say, hey, you love them. It's just that what you've been doing hasn't been working. We have to change the strategy. We have to change the blueprint, as well as someone who has been trying to get healthy and help. Oh, I've tried everything. And no, what you've been doing hasn't been working. And so have hope. I've worked with some very, very catastrophic or really down and out cases where someone attempted suicide 48 hours before treatment. Someone had been revived from an overdose. Someone had been psychotic, wandering the streets, and they're able to get back to a healthy place of living and live very healthy lives. And so for either people struggling or the family unit, just realize that you can still get your loved one back. You can still get healthy and make a change. We just have to revise the strategy or the blueprint. Yeah. So that'd be my first one. The first one I already mentioned, why loved ones continue to struggle is because they can. And so that's a big realization, is that goes back to what I was just saying earlier, is the family unit has to go back and look at the strategy book. I think the last one, this was kind of hard to choose among the 25 because I think they're all important, but one of the really important ones is the concept of validation. Validation is probably one of the most powerful concepts that I ever learned in one of my continuing educations that is important, not only worth working with clients, but I think in almost any relationship, because most people that struggle interpersonally or in a relationship, one of the biggest things they repeatedly say is, I don't feel heard or understood. And so validation is the concept, means to acknowledge someone's truth. Doesn't mean you have to agree with it. Doesn't mean you even have to believe it. But as long as you're acknowledging someone's truth, because that is a precursor to empathy. Empathy is to really truly understand someone's viewpoint from their lens, so to speak. And so, and that's what happens a lot with people who are struggling, is things like, you don't get me. Why are you drinking alcohol? You don't get it. You don't understand me, what I'm going through. Doesn't mean you have to agree with them, right? That, hey, alcohol is not the way, but you're saying, hey, it sounds like you're in a lot of pain. Sounds like you feel misunderstood, right? How can I best support you? So validation, I even write about it. It is I think, the cure to miscommunication and one of the most important elements to conflict resolution.
Yeah, absolutely. I mean, I think it's so important, especially with addiction, right? Because this person is in so much pain or hurting so much that they're turning to these things to numb it or feel better. So it's like they're really going through something. And for you to not acknowledge that they're going through something so devastating for themselves definitely seems like a very important key to helping everyone. Yeah.
In addition to what you were just saying too, a lot of times people out there coming from a loving place say, well, gosh, alcohol's so bad for you, or meth, or so bad for cocaine, THC, whatever it is, opiates, Xanax, in excess. And why you keep doing it if you know it's bad, if you know it's going to lead to a breakup or divorce, or it's going to lead to, and when they're at the point of in their illness or sickness, they don't see those consequences. And all they know is I have a lot of pain and I need relief. And so that's where a lot of people have that disconnect. And literally people say, hey, you drink a lot of alcohol, you have a DUI, stop drinking. You're anxious, start, stop thinking of those anxious thoughts. You're depressed, be more positive. And that's where that disconnect happens. So that's why validation to me is a really, really critical component of communication.
That's great. So, okay. So if we are able to get someone into treatment, there's always a risk that they might relapse or, have another spell of addiction to whatever it is. So, that has to be extremely hard for the family, right? Like you've already gotten your person that you love into treatment, they were doing better. And then all of a sudden they're kind of just repeating the same patterns. So what advice do you have for family members if they have someone that is repeating this, even if it's 6 weeks later or 6 years later? Like what advice do you have for someone if the loved one is doing it again and you have to kind of go through the whole process to try to help them again?
And that is a very common scenario for me. And one of the things I do write about, I broke down the different phases of the recovery process. And so treatment and recovery, right? Recovery is a plan in place for better outcomes, healthier outcomes. So I believe we're all in some form of recovery. We can recover from a medical condition, a cancer diagnosis, a breakup, a bankruptcy, a loss of a job, or even your child leaving the nest and going to college. So we're all in some form of recovery. And so I believe I broke down the phase of recovery process, but the most difficult, I believe, is in phase 1, which is the first 30 to 90 days. That's where most people will relapse on a substance or they will leave treatment prematurely because it's uncomfortable. They are struggling to make a change. They haven't reached that point of seeing the positive benefits of getting healthy. And I have that conversation a lot, like, oh my gosh, our son left and he's been in 5 treatments, or our daughter or whoever, wife and husband, this is them. They've been doing this for the past 5 years. Is they would be in treatment for 3 days and they would leave. And I would say, well, where do they go? Well, there's nowhere else to go. They come back home. I said, well, do you know the reason why your loved one can leave treatment prematurely? I must know, because they can. And so it's very important for the family unit to communicate and have a very unified vision, that you tell them that we're going to be here and we're always going to support you. We aren't just willing to support this lifestyle any longer because we're doing more harm than good. And what you do is you give the person the option. And sometimes people still have gas in their tank. They're not done ready to live this lifestyle. But I believe most people, so the premise of my book essentially is to put their loved one to a point of desperation, right? Because when they're put in desperation, they want pain relief. And sometimes when they have the option, like, I can get help or I can go to jail, you know what? I can get support from my family and have a home, right? Or I can wander the streets. And so that's the option you want to give them. And so those families that are out there, when they're family loved ones, is you have to really stick to your boundaries, have a unified vision, and recognize, why do they keep leaving? Because they can. So if their loved one leaves, you have to be very strong, is that these are the options at the table, what we're willing to support and not support.
Yeah. And that usually helps people come to the realization, or does it propel them into getting deeper into the addiction or addictive behavior that they were already a part of?
It can. So one of the key elements, though, I call it planting the emotional seeds or assertive love. Here's another knowledge out there that's well-meaning: tough love, right? We hear that all the time. We got to use tough love. And I get a lot of family members that take it to a degree where they believe tough love is this very strong, firm, to a point where I don't care, you get help, you get sober, but other than that, we want nothing to do with you. And I tell them that's very dangerous ground, because when someone's struggling emotionally, they're feeling hopeless or even suicidal, or they feel like they don't have any support, they're going to lean towards more of a giving up hope, maybe sometimes just ending their life or doing something detrimental. And so what you tell them is, we're always here for you. It's just that this is what we're going to support, not support. And so that's what's really, really important, to keep planting these emotional seeds. If you have a loved one struggling out there, you can text them and say, hey, thinking about you, right? Praying for you to get better, right? And it's that those seeds planted. I've seen that repeatedly in treatment where someone says, yeah, my mom's texts all the time when I was homeless. I didn't always think it. I was always mad at it, but over a collection over time was this realization one point where there are people that love me, the people that care about me. So it's really important to plant those emotional seeds and be very clear, though, that this is what we will support, not support. And you cannot love your loved one out of their disease. Some people say, well, I'm just going to love you ad nauseum and you'll snap out of your depression or anxiety or drug addiction. No, it's a different kind of love. And I call it assertive love, which is a nice balance between having rules but also intimate relationship as well.
Yeah, that makes a lot of sense. And then, so I want to shift gears a little bit. So, around addiction, obviously there's like a big moral stigma, if you will. Like, people are very judgmental, especially people from the outside. And that can be probably very difficult for the families that have someone that they're trying to help, right? Like, what do other people think about me? Or do they think this is just a choice and not an actual disease? So what advice do you have for family members and loved ones that are kind of worried about what the outside thinks as they're trying to help someone that they love?
Yeah. Well, the validation part is critically important. Yeah. And yes, one thing I write about too is it takes more than just willpower. That is one of my upfront a must knows, is because people think you can just white knuckle it and just willpower. In my experience, in my work of working in treatment in this arena, is I believe willpower is just 15% of it. It's important, right? But what's important is guidance, support, a fellowship is really, really important. What I said earlier, accountability. And so sometimes people think that, well, just white knuckle it and stop drinking, right? Are there some people that can do it? Yes, but those are outliers. Outliers meaning that rare percentage. Most of the people need other attributes and elements to be successful, especially in the long term. And so for many people as well is to educate themselves on an addiction, and as well as that there is that medical dependence, right? Especially with alcohol, people can literally die from a cardiac event or have a life-altering seizure from severe alcohol withdrawals. So there is a true physiological chemical dependence. And so but choice, I guess you can say, I'm not going to argue, there is a choice. We can't argue that. And it's just to help realize that your loved one struggling, they believe that is the only choice. And telling them that just stop doing it or it's harmful, they're beyond, and their level of sickness when they're deep into it, they're beyond recognizing or even caring of the collateral damage that it's doing. All they know is, I need relief.
Yeah.
And
they're not really thinking about others in the process, right? They're just trying to seek out that relief and feel better for themselves before they can give or feel better for others or give to others, right?
Sometimes they're motivating factors. Sometimes, my children, I'll do it for my children. You hear those stories, or maybe they have an aha moment. Maybe they had a near-death experience, and those can happen as well. I've seen many people get sober or healthy because of their children, but that's not the same for everyone. Not the same for everyone. Is there's some people where they're sacrificing their livelihood, their careers, and their families, even kids, because of that's how deep in their sickness they are. And but one thing I wanted to mention earlier, if you don't mind, though, but research shows, in regard to keep planting those emotional seeds, that research shows that people who perceive or believe that they do have support out there tend to fare better than people who believe or perceive that they have no support. So you can be estranged from your family, but if you believe that, when it comes to it, I pick up that phone, they'll be there for me. Those people, just the perception that there's a support system out there, tend to have more hope. And you can have some people who have loved ones who are there to support them, but they don't perceive or believe that they will support them. Even in that case, they struggle. But those people who believe that there's some type of help and support can help them through those really rocky times and fare better than people who don't perceive that they have any type of help or support.
System. Yeah. And then so we're talking about support systems kind of for the person on the more addiction side, but what are some resources for people that are on the family side? I'm assuming like they're going to need some mental health support or maybe some, group therapy. I think there's like Al-Anon and things like that. Did I say it right? Yeah.
Yeah. Al-Anon.
And so what other sorts of support systems are out there that can be effective for helping the family kind of through this process as they're helping their loved ones?
Yeah. I mean, the one I mentioned earlier, the National Alliance of Mental Illness, is a global organization. I think one of the larger mental health support organizations for people, family members, or people struggling with mental health or addiction. So, National Alliance of Mental Illness is a great resource to start. There's even Parents of Addicted Loved Ones, PALS, PALS. That's another great resource. And of course, when you mentioned Al-Anon, that is under their umbrella of similar to Alcoholics Anonymous, and then all the Anonymous, but for family members. But definitely search, ask a therapist, pediatrician, Google support groups. There's online help, warm lines, hotlines. There's a lot of support out there and that people aren't aware of, but those would be great places to start as well. And also do an Amazon search on self-help books, put titles, family help, resist struggling loved ones, addiction, and you'd be amazed of the level of resources out there. Now with AI especially, there's a lot of accessibility information and support.
Absolutely. So we have time for one more question.
Sure.
So you've been in this space for 20 years, which is a very long
almost
time.
20 years, almost 20 years.
Which is impressive. So in your practice or kind of just in your time in this space, what's one success story that really sticks out to you of someone that, was struggling with addiction, had family kind of come in and help, and they're doing really well in their life now? I'm sure you have many, but one that sticks out.
Well, if I may do two, because I think the second one relates to family dynamics. But number one, I was kind of alluded to earlier, where a client literally attempted suicide. 48 hours prior, was addicted to opiates, severe depression, and literally made an attempt, a severe attempt, and was discovered by loved ones, got the person help, and was able to maintain sobriety and have a new zest for life. And so that's one that really, from someone from going to having no hope in life to finally having a glimmer of hope in life. And one of the critical elements was the family system. The family system was very supportive, and that was a critical element. The second one was a family who was estranged in terms of the parents, because they were divorced for almost 12 years. And what brought them together was their struggling young adult male son who was struggling with substance abuse and so forth. And so you had a family who was estranged for 12 years, these parents who would sit on opposite rooms during family session time, to sitting next to each other, to literally towards the end of the treatment time, driving together, carpooling together. And so I say that this disease can fracture the closest of families, but the recovery process can actually bring families closer together because of this realization of we have a part in what we can do to improve and change and contribute positively to the overall family unit. So those are the two top stories, and you're right, there are plenty, but those are the two top ones that stick out to me and that I reference quite often.
Awesome. Thank you so much. This has been amazing. If people want to find you online and get a copy of your book, where can they find you? Well,
first place is my website. I'm assuming you maybe put it in the description, but it's drbrianlicuanan.com. There you'll find my services, an excerpt of my book, and all my media appearances and articles and podcasts I've been on, and on social media, TikTok and Instagram at Dr. Licuanan, and YouTube at Dr. Brian Licuanan.
Awesome. Amazing. And we'll link to everything in the show notes as well. Thank you so much. I really appreciate you being here today and sharing this information.
I appreciate you having me again.
Yeah, absolutely. Thank you.
Thank you.